Hello physios, I welcome you all to our channel Physiotherapy. We are back with our next lecture on laser therapy, and here we are going to study about the dosage. Okay, so how we are going to set the accurate and most appropriate dose of an individual. Okay, so my name is Vijay Kumar and let's get started. See, the dosage of laser is not, we can say, well justified. Okay, so there are some studies, and according to some studies I have written some, we can say, general ways to find the dosage of laser irradiation to a patient. Okay, so its dosage depend upon certain factors. So the first is wavelength. Okay, in wavelength we can say that the diode laser, okay, which emits some sort of infrared radiation, okay, they emit some infrared also, and they have more depth of penetration. Okay, you can see it is 3 to 4 millimeters. Okay, 3 to 4 millimeters. So this can be used for depth lesion. Okay, that is the lesion which are deep inside the body, such as any musculoskeletal disorder. And similarly the helium neon laser, okay, here the depth of penetration is 1 to 2 millimeter. So this can be used for superficial lesions such as wound. Okay, either it can be surgical wound or any other pressure ulcer. Okay, so regarding wavelength we are going to just understand two things, that diode laser have more depth of penetration. So for the structure such as ligaments, okay, if there is any kind of sprain of a ligament, okay, so we are going to use the we can say high depth or more depth diode lasers. But for superficial lesion, helium neon lasers can be used. Okay, second factor is energy density. This is we can say a bit mathematical point, and you just need to focus what I am saying. Energy density, it is given by joule per centimeter square, and energy density is also called radiant exposure. So energy density, energy means E and density means, energy density means the energy falling on a unit area. So we can write that ED, energy density, is equal to E upon area, and unit of energy is joule and area is centimeter square. Okay, so the energy density will become joule per centimeter square. And this is the very important part, that power output, mean power output, which is in milliwatts, is fixed. Okay, so the power output is fixed, and in our next point we will study that even if we are using pulsed output, the power, that is the total power or the mean power output, remain same, which means that this mean power output is fixed. So let us first understand what is power. Power is equal to energy upon time, energy upon time. So we can write it as energy unit is joule and time is second, which will become joule per second, and this joule per second is also called milliwatt. Okay, so joule per second can be written as milliwatt. So this is the mean power output. Now if we multiply this power output with time, it will again give energy density. How? See, power. Okay, first of all we will study what is power density. Okay, power density. Now power density will become power upon area, and power was milliwatt, area centimeter square, so which is milliwatt per centimeter square. And now if we multiply this power density into time, okay, it will give further energy density. So we will use milliwatt per centimeter square into time. Okay, milliwatt per centimeter square into time. Now we will put milliwatt is equal to energy upon time. Okay, milliwatt is equal to energy upon time from here. So we put here, and this T can be cancelled out with T, which become energy upon centimeter square, which was energy density. Okay, so this is important to understand. Okay, so in energy density means amount of energy falling on a particular area, E upon centimeter square. E upon centimeter square, that is joule upon centimeter square. Finished. Next was power, and I want to explain that mean power output will be fixed. So what is power? Energy upon time. Energy upon time, which means energy is joule and time is second. So it will become joule per second, which is milliwatt. Now next is power density. Power density will become milliwatt per centimeter square, that is milliwatt per centimeter square. Now in our books it is written that if we multiply this power density with time, it will give energy density. So we multiplied milliwatt per centimeter square into time, and we put this milliwatt as E upon T, and T is cancelled by T, which become E upon centimeter square, that is energy density. Okay, so this whole you need to understand, but this particular portion is very important for to understand the next part. Okay, next is pulsed output. See, let us just read the line. So on some machines, the mean power output is always same. I have explained that mean power output is fixed, even if we are using pulse frequency or pulsed mode, that is regardless of pulse frequency. This is achieved by adjusting the pulse duration. What I am saying, that the total power output, okay, so the total power of laser which is given in a particular time is fixed. Okay, so that what was power? Power is energy upon time. So the total energy of the laser which is given in a unit time. Okay, so total energy which is delivered by the laser radiation in a unit time is fixed, and it is even fixed in the pulsed mode, which means that even if we are using the pulsed mode, then also the power output is same. But how can this happen? Let us understand it with an example. See, low pulse rate or frequency have longer pulse length. Let us say we have pulse rate or the pulse frequency as 5, which means laser radiation will come 5 times, and let us assume that it is coming for 5 seconds. Okay, so the total will become 5 into 5, which is 25 seconds in a minute. Okay, so the pulse frequency of the laser is 5 per minute, and when it comes for one time, it is of 5 seconds. So total time will become 5 into 5, 25. And let us say now the pulse frequency or pulse rate is 10, which means it is coming for in 1 minute it is coming 10 times. But now to maintain the mean power output, the duration will become, it is coming 10 times, yes, it is okay, but instead of 5 seconds it will come for 2.5 seconds, which will again become 25 seconds. So you can see the net effect is 25 second irradiance of laser. So when the pulse frequency is low, duration will become high, but when the pulse frequency is high, duration become low. Okay, so that is what I have written. Let's read. In some machine, the mean power output is same regardless of frequency. And how this is achieved? Low pulse rate or frequency have long pulse length. Okay, so it was 5 seconds and the duration was also 5 seconds. But for high pulse rate, okay, high pulse rate, that is 10 pulse rate or pulse frequency, the duration will become small, that is 2.5, so that the total time for which the laser beam is coming is same. Okay, so that is what I want to explain. Okay, and this low pulse rate with the long pulse duration is used in acute condition, while high rate which is having short pulse length is used in chronic conditions. Okay, this is about the pulse output. At last we are going to just understand the area of treatment. Okay, for discrete lesion we just apply the laser over the body part which is to be treated, that is by direct application of laser onto the skin, and gentle pressure can also be applied for better penetration. For larger area, we use grid method. Let us say this is an area where we want to apply laser. Okay, so we will divide this area into grids. Grids are smaller parts, and we will apply. Let us say this is the pen of laser. Okay, it is emitting laser. I will apply it here, then sometime after here, then here, and then here. So we are we can say giving laser to each and every grid. Okay, larger area we use grid method or scanning technique. This is scanning technique. Once here, then down, then down, then down. So like this. Okay, so it is the scanning method. Also we can apply it on the open wounds, and on the open wounds we have two choices. Either we can apply at the periphery like this, or we can just cover the wound with the sterile clear plastic. Okay, and apply the laser over it. Okay, so these are some methods. Okay, so for discrete lesion, that is closed. Okay, there is not any kind of open wound, we can just apply over the skin. For larger area we can use grid method, scanning method, and in open wound we can apply it at periphery as well as by covering the lesion. Okay, so this is whole about the dosage. And at last I want to just explain that laser have three type of applicator. First is the single probe, which is having a size like a marker pen, and we can apply it just over the body part to be treated. Next is the cluster probe, which contain a number of probes which are mounted together in a handheld applicator, and its advantage is that we can apply it on larger area, that is such as 25 centimeter square. Okay, so cluster probe can be used on larger areas. And the final method or the last method is the scanning method, where larger area can be treated, and here we are going to place the we can say emitter 30 centimeter apart from the body part, and it will just scan the whole part and apply the laser. So what are three methods? First is the probe method, in which we are having a single applicator like the size of marker, and it can be applied directly over the body part. Second is the cluster probe. A lot of probes are mounted together to form a handheld applicator. And last is the scanning method. Okay, so with this we are completing our topic laser therapy. If you have any kind of doubt, you can ask me in the comment section. I will try my level best to answer each and every query regarding the topic. Okay, so till then you keep on studying. Thank you to one and all.